live from the American Academy of Stem Cell Physicians. We're at our convention for August 2019. We have a great panel today, members of the organization who have been participating in the conference. And what I'd like to do is ask each member to give a description of what they do and something about their practice. So I'm going to pass the mic.
I'm an interventional pain management physician. I practice in New Jersey, outside of New York City. I also do regenerative medicine. I've been practicing for over 30 years, and I have a strong interest in this type of regenerative medicine treatments.
Had been practicing for 35 years, low extremity surgical practice, limb preservation. Presently, I run BioStem Life Sciences, a placental tissue bank, and we make all of the perinatal placental tissues that you should be using.
I'm a specialist in environmental medicine, which integrates the integrative medicine, functional medicine, neuroimmune endocrine medicine, and I practice also regenerative medicine in integrated way. As my pediatric patients started getting older, I realized that there are some problems you cannot resolve, and so I got interested in regenerative medicine, and regenerative medicine gives me a broader scope that I can diagnose and treat my patients and make them better. When they are better, I love it, and that is my dedication.
Hi, I'm board certified in integrative and preventive medicine and do regenerative and functional medicine, and I see a lot of people with chronic disease, autoimmune disease, and I see a lot of people who come to me after they've seen everything in Western medicine and they haven't gotten any better. So I focus on foundational cellular health and go from that foundation.
Hi, I practice in the fire 'em up model, as many of these people have said, functional, integrative, restorative, regenerative, internal medicine. And I predominantly within my practice use a lot of foundational parts of medicine, but most importantly, cell-based medicines, which have been remarkable in helping patients be well and optimize their performance or be better from a health perspective, because many of them are very sick and we're trying to return their health back to them.
My base is in internal medicine, and actually reached out to Dr. Kathleen O'Neill Smith last year because my son had a TBI, and she had great success with her own son with the TBI. She's helped me in quite an amazing way, and so we've come together to build this fire 'em up model to teach the public as well as doctors functional, integrative, regenerative, restorative internal medicine. In addition, I live in Gainesville, Florida, and have a 6,000 patient base a primary care insurance-based population, as well as a direct access functional regenerative medicine practice. So happy to be here. Thank you.
I'm an osteopathic physician. My main office is in Lansing, Michigan. I've been practicing for 32 years. My main focus is, I call it non-surgical orthopedics. I do prolotherapy, neural therapy, low-dose dextrose therapy for neuropathic pain, as well as prolozone. I also do other things to enhance or prepare my patients for the treatment and to enhance the effectiveness of my injection techniques, such as bioidentical hormones. I've done innovative work with hormones for 32 years. I also do all the oxidative therapies, nutrition, IV and oral nutrition. It seems like I'm leaving something out. Oh, and then and over the past few years, we've also evolved into the use of platelets, stem cells, and other placental growth factors. Thank you.
Hello, everyone. My background is family practice. I did emergency medicine in San Francisco for some time, but I've landed back home here in Florida, and I am so proud of being a part of this community of physicians that are trying to think outside of the box. My practice in Naples is geared towards wellness. It's not a disease-based model. It's a wellness-based model. I practice regenerative medicine there. We do IV therapy. I do a lot of bioidentical hormones. I get patients feeling good. We optimize their conditions as best we can. This is a very exciting conference, and I'm so pleased to be a part of it. Thanks.
I'd like to ask, can you share with us some of the outcomes that you have seen using regenerative techniques?
Sure, I'd love to. So my practice, I mostly treat people with orthopedic conditions, joint degeneration, spine conditions, whether they're disc herniations or degeneration. And I really hate to see my patients go for surgery if they don't absolutely need it, because surgery alters the natural anatomy of the body. Once you alter the natural anatomy, you never get it back. You could always go for surgery, but you can't reverse it. So throughout my over 30 years of practice, I've been researching and performing multiple treatments that have enabled people to get better without surgery, such as ozone disc injections, and more recently, regenerative medicine, stem cell, and other regenerative treatments. And I must say I'm extremely pleased with the results. I feel honored to be able to offer these treatments to my patients and give them something that will help them get better, improve their function, and avoid surgery. And it's safe, and in addition to being effective. So I'm very happy, and my patients are happy.
Excellent. I agree. This has been an incredible journey, starting back in the late 80s, early 90s, working with platelet-rich plasma, and then adding in extracorporeal shockwave therapy. Always looking for the best thing for my patients to improve their outcomes. In my case, trying to save their limb or get them to recover from trauma. And over about 10 years ago, came across placental tissue, and it's just been a game changer. It's as close to miraculous as I've ever seen. Taking diabetics, being able to save their limbs by converting these non-healing wounds within 2 months to a healed state. Being able to not have to do a joint replacement on an ankle, being able to keep them quite comfortable for years at a time using placental allografts. And the list can go on, and it has been an incredible joy to me to see my basic research from 10 years ago being utilized in the shoulders and the elbows and now in multiple organ systems. So being in this group is an incredible honor to hear everybody and everybody's point of view, bringing new skills, new protocols, new thoughts of how we can change the face of medicine and make our patients' outcomes superior, give them a better lifestyle, a sense of how they can live without pain. And so thank you all for having me.
Thank you. My journey started when my husband was told that he requires the knee replacement surgery. And he had a full range of motion, only that he had pain in his knee when he walked. So I came across AJ, and after listening to his lecture, I told my husband I'm calling him. I already made the appointment, and we went, and AJ made me to give him a shot. He just completely monitored, but I had experience before because of my practice in pediatrics. When the injury occurred into the patients, I was the first one to drain the knees or the ankles, so I did have experience, but AJ was very cooperative, and he had a wonderful results. Then I started treating the patients with the macular degeneration because my husband is a retinal specialist, and some of his patients came to me for nutritional therapies, and their vision was improving. But with the amniotic products, his vision even improved more. And not only that, but there was anatomical evidence that it improved. So I think that was a fantastic, because there is no treatment available which is reversible in age-related macular degeneration. Furthermore, there are patients, I have a large community of chronic Lyme disease patients I treat, and some patients have a Parkinson's-like symptoms, and some patients have a cognitive abnormalities, some patients have joint deformities developing from them, accelerated osteoarthritis. So I have started treating them and completely reverse their speech, gait, balance, and not only that, but their degenerative joints have started improving, and I've incorporated peptide therapy. And so the patients, those who are coming and telling me that the small joint replacement that they need, then I say, okay, give me a chance for a month or two, and I have reversed many of their conditions, including treatment of my 92 years old mother. So I cannot practice now without the support of regenerative medicine.
Hi. So I came to medicine kind of in an odd way. I was I've been a medical herbalist now for 30 years, and I was a massage therapist a while ago, like 30 years ago. And I then became a trauma nurse, so I've had this weird kind of path. And then I got to med school, and it was apparently a really good time for me to have breast cancer. So I did that during med school as well, and I've been now for over 16 and a half years dealing with the ramifications of all of that on top of a previous head injury I had. So regenerative medicine has helped me with the sequelae of my cancer, like peripheral neuropathy and cognitive issues. And it's the future to me. I mean, I can't go back to any other form of medicine I used to practice. Again, supporting the foundational cellular health, I think our bodies can do all kinds of things that even when I was in med school, we were kind of told, oh no, those things don't heal. The body is amazing, and if we give it tools, it uses them and we heal. And many of the tools today are Regen Med tools. It could be PRP from yourself, it could be perinatal tissue or other biologic allografts or peptides or all the other things that we are learning. And every time I come to this conference, something new that I can apply immediately with my patients is learned, and it's fabulous. I've already been communicating with some of my patients, and we've been here, barely 24 hours. So this group of providers is an amazing caliber of people, not just what's in their heads and how they work, but that they share. We all share. And that's not always the easiest thing to find. So it's an amazing organization. I'm beyond happy to have been included, and very surprised that I'm on this roundtable. And I enjoy coming to Miami every quarter to learn more from these amazing people. And it's the way of the future. I mean, medicine is changing at a rapid pace, and this organization helps us all keep up to date with and be on the leading edge of things that are happening. So it's one of my phrases, this is total nerd candy for me, and I think for a lot of people here, and it's fabulous. I was talking to my husband, and I'm talking really fast because I'm so excited. So I'm going to stop now. But thank you to everyone for this organization and being a part of it, and I look forward to it every quarter. It's a highlight of my career.
It's wonderful. So I started as a science teacher in the early 80s, teaching high school, when we thought you couldn't affect DNA or genes, right? So now we know, since 2000, that you can certainly affect DNA and genes just sitting at this table and enjoying your company or eating this food, right? So it's wonderful because the future of medicine is here right now, right? We all know that and we're all practicing it. It's hard to keep up because the pace of medicine is fast. It is a fast-paced world, and in order to keep up, we need to lead and collaborate. And this group has come together to lead and collaborate in this industry, right? To bring together people who have experience and good results that they can share and that they can collaborate with their colleagues and teach. And it's quite remarkable when you bring together a group of people who have results and want to teach and share and lead and collaborate. And everybody has a story, right? Everybody has a story, a personal story, a story about their family, a story about their patients. So I now, because of my son who had a traumatic brain injury, 5 intracranial bleeds, and was, basically told that we'll just watch and wait and see what happens, and he's 19 years old. Well, being an elite level Olympic athlete, I don't watch and wait, right? So I luckily, as all of us have at this table, I started early learning this and then had the collaboration of all of people like you to come together and help my son fully recover from 5 bleeds, right? When he could have been DOA and in the morgue, where I have also worked. So that was a relief. But now I spend a lot of time with doing traumatic brain injury. I have a large group of Navy SEALs who are transitioning from the military into civility, and they have a lot of injury, and that needs to be healed. I work with a lot of athletes, a lot of elite level athletes, like the modern day warriors, the NFL, the NHL, and help them to recover and to heal their joints, their brains, their gut, because we all know it's all connected, right? And so you've got to be paying attention to all of it. And the best thing is, this medicine, what I think about is, what if the things we waste every day, meaning placenta, blood, cord blood, you name it, peptides, what if waste was the best natural resource we have? What if we could use that to regenerate? That's what we all do, and that's what we all know works. And we know that that's the future, not just economically, but therapeutically effectively. It's safe, it's effective therapeutically, it's cost effective, and it's sustainable. And those are important principles to have. So it's wonderful to have a group of colleagues to share, so you're never alone when you're managing something very difficult. And I'm grateful to all of the people that I get to speak with and share and grow with. Thank you.
Yeah, so Dr. O'Neill Smith is actually the leading clinical authority on peptides, I think, in the world, and she's always willing to lead and collaborate. So I think we're really privileged to be able to work with you, Dr. Kathleen. So what's happening in my practice is there's 1 in 5 people who have an autoimmune disease now. It's like an epidemic. We presented at the controversies on rheumatology and autoimmunity in Florence, Italy in spring with Dr. Yehuda Schoenfeld, who wrote The Mosaic on Autoimmunity. It's the textbook for autoimmunity. And regenerative medicine, especially peptide therapy, has a great role in treating and reversing autoimmunity. So just a couple examples. I have a Colombian surgeon who had the Zika virus at 40 during a pregnancy and had Zika-induced rheumatoid arthritis, and actually at 41 went on disability, couldn't operate, couldn't take care of her 2 little children anymore. And through our Fire-Em-Up model, which involves a great deal of regenerative medicine and peptide therapy, she's now back in the OR in 3.5 months. So we balanced her hormones, we gave her peptide therapy, and we gave her nutritional support. She's now off of her methotrexate, and she actually has osteopenia, and they had been giving her courses of prednisone with methotrexate. So now she's just on peptide therapy, nutritional therapy, progesterone, and she's so happy. So her adrenal score, the WHO-5, went from 5, which is like flatline, can't take care of your family, disability, to 23, last week. And this is the type of medicine we offer. And I'm so happy to be able to hear great ideas like Dr. Nebling. Dr. Nebling's a DO, and he's been teaching us about fascia and crown of thorns and different ways to treat pain. And this is the type of thing that I live for. Is I really want to be the best doctor I can for my patient population. And I feel like learning from different specialties and people who are willing to collaborate and share is just such a unique and special situation. So thank you.
What I've seen happen in the beginning, 1987, when I finished training, I joined the Bluegrass Clinic, fairly famous osteopathic clinic in the Midwest. I was introduced to ozone. Dr. Hull's father was the first one to inject ozone into the knee. So my first patients had these large arthritic knees, and injecting them and being able to make them pain-free. They'd have to come back for a maintenance shot because I hadn't evolved enough and was holistic enough to help grow the articular cartilage. But it was amazing to see these people go on year after year and never have knee replacement. So that was my start into that. And then adding other therapies to it, and being more holistic, learning about how the mouth affects the body, how the teeth are connected to that, and having an infection, cavitations, how that can block your healing ability. So being introduced to that by a holistic dentist, we did miracles together. Basically, someone may even had an empty socket. They'd go in and clean out a cavitation in the bone, and lo and behold, the person would no longer have knee pain. They still had some instability and did need shots to the stabilizing ligaments to regrow those, but just amazing. So working with other really smart integrative physicians, other specialties, it's neat working with a holistic podiatrist or the holistic dentist, holistic ophthalmologist. And so in doing that, our office, we've evolved and adding more and more techniques. So I've seen miracles happen with macular degeneration and retinitis pigmentosa. That does involve the use of some proliferative type agents, but also directing those with microcurrent, which also stimulates the stem cells in our own body's natural healing ability. And that's very rewarding to see people who couldn't drive now be able to drive. And these are people 90 years old. They got their license back, feel safe driving. People with retinitis pigmentosa, young, that were just looking at somehow holding on as long as they could, not tell people how bad they were so they could hold on to their license, and then figure out how they would make a life for themselves, and having them be able to say, oh my gosh, Dr. Nebling, I'm seeing behind my head now. And what they meant is that their peripheral vision had totally corrected. They're able to see, able to get a job, able to get married. So those are some of the special cases we have in our clinic daily. My most common joint to treat is the knee. After that's the low back. I have many people, post-surgical patients, who are pain-free and are doing high-level activities, such as doing something called the WeMac, where you ride your bicycle from the capital city in Michigan up to the Mackinac Bridge and ride it back, and able to do that. And they had their meniscus totally removed, had a meniscectomy. So those type of miracles we see regularly in our clinic. Thank you.
Thank you. We all have incredible stories to share. I hear them over and over and over again. And just to be so blessed to be in a room with like-minded physicians where we're not using a big pharma approach with so many, side effects and disastrous results. Our therapies are principally safe, cost-effective, and effective for our patients. I mean, we all have those miracle stories. I know I do. I'm really excited about working with systemic illness, neurodegenerative illness, Parkinson's disease, dementia, Alzheimer's. I also do musculoskeletal, disease and peripheral neuropathy and vascular insufficiency in lower extremities, any extremity. We're getting tremendous results. This is the future of medicine. We are on the cutting edge. I'm so proud to be part of this family of physicians. Sometimes scientists, as we all know, don't share their data very well. We don't play with each other very well. I can tell you right now, this group has opened my eyes to so many things. And I'm not afraid to ask a question of my colleagues. Sometimes in academic medicine, I've been to a lot of academic centers, and, you kind of, the clinicians or the professors, with their super degrees and their awards, they're kind of looked down. They teach above here at this level because they're in their tiny bubble. What happens here with us is we teach each other, and that's the beauty. That's the beauty of the academy. I'm not afraid to ask a question here. I'm not going to be belittled. There are no bad questions to ask. I just love this experience, and I love more than anything else when patients come to me and they say, you know, Dr. Potter, I got to tell you, I've been to 5 different doctors, 6 different doctors, 7 different doctors, every subspecialty you can think of. One, they don't spend the time with me that you do to listen to me, and they don't tell me I have other options than what's in their little tiny box. I try not to cry when they say that, because I know because of this academy that we can offer them. I have stuff to offer them, you know, and it works. It works. So welcome to the future of medicine.
Thank you. It's a good segue for the next question and last question. Where do you think medicine should go, and what role can the academy play?
Well, I feel that the academy is at the forefront of where medicine should go. As I said before, I've been practicing for over 30 years, and it's, as what other doctors around the table have said, this is a very unique organization because we all put the patient first, and that's actually, it sounds like it should be that way, but it's not that way with a lot of other organizations. And for example, economics, somebody who runs the organization and has an interest in a certain product will have a speaker that has a totally different take on that product and will present the totally different point of view. And that's true transparency. That gives us the ability to make our own decisions as physicians of what's best for our patient, because without having the knowledge of what the other types of treatment are that are out there, we can't weigh the pluses and minuses and decide what's going to work best for our patients. So everybody, I'm sure, at this table and in this room agrees that regenerative medicine and all the little pieces of regenerative medicine, whether it's bone marrow-derived stem cells or amniotic matrix or peptides or combination of different things or PRP, is the future of medicine. These treatments not only work, so they're effective, they're cost-effective, and they're safe. And this organization is in a very ethical position and is at the forefront of this emerging, ongoing, it's not even emerging anymore, it has taken hold. And unfortunately, I just want to say one more thing, is that I think the United States in a lot of ways fell behind in this because of regulations, etc. There are a lot of countries in the world that, some of them we might think of third world countries, I don't like that term, but it's used a lot, that are way ahead of us in these treatments because we fell behind due to regulations. So it's really great that we have a group of people that are very dedicated to keeping these treatments available to patients and advancing the knowledge of these treatments. So I'm very proud to be part of this organization.
Excellent. My perspective, having practiced for a gazillion years, is now I want to help bring regenerative medicine into the regulatory compliance so that we here in the United States can freely use these regenerative therapies, be it bone marrow aspirate, be it SVF, be it placental tissue, peptides, and bring it into the light. And from my perspective for placental tissue is to get the regulatory compliance, to get the biologics license, to develop the level 2 evidence that is necessary, that we need. We all have great anecdotal evidence, but we really need to raise the bar, provide the level 2 evidence, the randomized controlled studies, so that we can be secure that we're not going to be attacked for being out of the box too far. And so that's my goal for this organization, and for me personally, is to now take it to the next level. And so I appreciate all of your input. Everybody here has really got some incredible perspectives and experience, and I appreciate every minute that I hear everybody's point of view and their successes. So thank you.
The future of regenerative medicine is going to be very, very bright. And the future of this organization, American Academy of Regenerative Medicine, is going to be very bright. The reason is there are members, those who have a dedication, they are very, very keen about knowing, and they have a special expertise in whatever area they are practicing, and this is another niche that they found, and they are going to integrate, and that is going to take this regenerative medicine to a next level, and it's going to really go with the wind at the speed of light. So one thing I want to say, that this organization in such a short period has achieved such a nice height of achievements. It's indescribable. And furthermore, that they have started having a examination board. Their candidates are ready for it, and they will be certifying the expertise of the physician. So there will not be a physician of regenerative medicine who's going to put a board on their office and say they are practicing regenerative medicine without having either the background or the experience or the knowledge or the education. Because the education is very important, no matter how much medical knowledge is there. And education makes you to integrate into your current knowledge. And then you become an expert with an experience, and then you get certified. So this is one of the very good steps that they have taken, and I wish all well.
Excellent. So the future of medicine in general, when I was a kid and I'd watch Star Trek, and then when I was a little older watching Voyager or Next Generation, whatever one Dr. Crusher was on. So I'm a bad Trekkie, I don't remember which one that was, but I always wanted to be Dr. Crusher because she could do these amazing things. She could regrow a spine. I can't regrow a spine today, but we're getting closer to be able to do some things that we never thought were possible. So it's exciting and thrilling, and I mean that's what regenerative medicine means. We regenerate things, we rejuvenate things. It's not like Frankenstein, but it's in tune with nature. We're using very natural ways with very few to no side effects to do this. It's bringing us back to Mother Nature, really, and I've always wanted to practice that way. And so I think of it definitely as thinking outside of the box, but we're keeping it on the spreadsheet because we're building the databases to prove that these things work. Things that we have, in some cultures, used for thousands of years that some people brush off like they don't mean anything. Thousands of years, that's like a lot of data sitting there. We know some of these things work, and some of the newer things we're learning and building these databases to be able to prove and show the safety and the efficacy of all them. And it's like I think about it and I start to drool because, again, it's all nerd candy to me, and I'm a major nerd, and I don't apologize for that because it's so exciting what we can do. I I was like an 81-year-old woman after I went through my cancer treatment. I had very hardcore chemotherapy. I had a ton of radiation. I had multiple surgeries. I still finished med school. I just don't remember a lot of it because of, what that did in my brain. But and I'd had a previous head trauma. I couldn't walk in a straight line because of my peripheral neuropathy. I'm a great guinea pig for myself. I use all of this on me. And I can balance on one leg now because of all this that we're learning today, all this that the Academy brings to us, and all the information we share. It is phenomenal that I, in 16 and a half years, have gone from a debilitated woman to what I can do now. And it's because of the work that we're all doing. And it's, again, I start to drool when I talk about it because it's so fascinating and I'm so passionate about it. And the neurocognitive things that Dr. Farshin and everyone here, that we teach each other. We used to think you insult your brain and oh well, that's not going to recover. And we know our nerves and our brains recover. The plasticity is amazing, and we support them with all these techniques, and they blossom. And it doesn't matter how old you are. And I mean, this has been literally one of the best things in my healthcare providing career is this academy and what we share and learn. There's nothing else like it. And again, it's an honor to be part of it. And back to you.
So wonderful. Well, technology, artificial intelligence, Silicon Valley, they're here to stay. And medicine has changed because of it. And it's not going backwards. So we once had an approach that was to treat a disease. And now we have an approach which is to treat a patient. And in this type of medicine, we're obligated to do it responsibly. We're obligated to collect the data. We're obligated to do the research. We're obligated to collaborate because it's bigger than any one of us. And 1 + 1 is 11, and 1 + 1 + 1 is 111. So I think it's really important that we come together as a group and that we pull this data together. This is disruptive technology to the status quo. The status quo is sickness-based, and as some of you mentioned, you have a wellness-based practice. There's nothing wrong with either, but they have to be together. And we have to bridge the gaps, and we have to work with the FDA, and we have to create the training because it's personalized now, it's patient-centered, and there's no number 1 or number 2 at McDonald's anymore. There is no one-size-fits-all for anybody. So even if you have breast cancer and you need a chemotherapy, you can measure what chemotherapy is best for you. There's not just one breast cancer chemotherapy anymore. So this technology, this space has now been disrupted. We have to be responsible, work together, be collaborative, and create an understanding and create a source and a space for sharing information to bring this into the future responsibly. This isn't something that should be on every corner. This is something that needs to be in the hands of the specialists who have trained and who have an understanding and want to be responsible in this space because these are very special therapies. When you're working at the level of a cell and you're not at the tip of that iceberg anymore, you're deep at the base of the earth. You're deep at the center of the earth, and you're no longer. This is not voodoo, but this is where we're at, and this is what we need to be bringing into the future in a way that's collaborative, responsible, and continues to learn and progress appropriately. So it is moving at the speed of light, and we need to be aware of that, and we need to help each other to understand how to bring this together.
That was really well said, Dr. O'Neill Smith. Very good. So, yeah, the only thing I have to add is there's this great tidal wave of many forces coming together. I work with a lot of pre-medical and medical students at the university, and they're the ones that are pushing for cellular-based medicine, not their professors. So you have that, plus they're very techno-savvy, and they want bio-natural interventions. They don't want pharma. They're just not aware that there are any other options. So I think that we really have to include them in terms of what the Academy should do, should include them in this conversation with scholarship, because they're going to change the future with us. The other thing is that I agree that we need to keep registries of all of our cases, and the power's in the numbers, and we need to collaborate on that. And finally, I think it's really important to be self-policing as an organization, and really not that we're going to confine our thought processes, but that we run it by each other and make sure that it makes sense, so that we first do no harm, so our interventions are safe, effective, and sustainable. So I think the future's bright. I'm really excited to be in this space with you all.
So the question, where do we think or see medicine going in the future? And I think the future looks bleak for traditional medicine, insurance-based, hospital-based. They're reductionist of thought that guides and control and education by the pharmacy, the linear view of disease, and still the thought that we have one medicine or one technique and it affects one disease or one molecule. And all of us here, as we talk about holistic or integrative medicine, we know that's not true. That's not our model. The other thing, we believe that the body has the ability to heal itself. So there's a philosophy that guides us versus this mechanistic reductionist mentality which predominates medicine in America. And as we believe that we are made of a series of systems that are interrelated and integrated. And so that's why we practice holistic medicine. We're not about how to get one stem cell and put that one stem cell in one place. We are very integrated group here. But I think it's bleak. I think at some point there's going to be a turf war. It's already going on, or battle for it. And I think it's unsustainable, the type of medicine they want to do through insurance-based medicine. We cannot afford it. It goes on. How I think we can help is, as was just said, the younger medical students coming out, younger people, they want to learn. What about stem cells? They want to learn more about nutrition. They're demanding that in medical school, and they're seeking out places they can get some type of good training. This is a place to bring residents so they can see, guess what? We talk to podiatrists here, we talk to dentists here, we talk to eye surgeons here, we talk to internists. It's interesting hearing the different careers people have had, and now they're doing this a variety of integrative techniques to help heal their patients. And so that, I think we can play a role in that as we practice good medicine here, meaning good techniques, good standards, and the starting up of studies that'll be supervised or overseen by institutional review boards for making sure they're ethical and well-done studies. That's also hopeful for us. So when the time comes, we'll be able to be, I say, an authority, or we'll have credibility if we need to give information to the medical board because a question comes up and they know nothing about it. We'll be able to offer that. If some legislation comes up, we'll be able to offer, and again, we're a group, we'll have people who have been board certified, we'll be able to offer credibility in that area, as the rest of it, I say, starts to crumble, starts to fall away at some point. The other thing that's is happening besides young medical students, of course, are the baby boomers. They're not happy with what's happening. When they look at that, there's 4 million people with macular degeneration now, and the next 5 years is predicted to be 25 million. I want that to happen to myself. They don't. And what are they offering them? Injections to the eye. Well, we have something holistically, and we can have studies showing that those work. Under the help, perhaps, of the ophthalmologists. Things like that are happening, and then with the baby boomers, they don't want to be passive about this. They want to see some change, and so that will push it towards change. But again, we'll be able to contribute with some credibility. What we do with stem cells, or I want to call it growth factors, etc., proliferative therapies. Thank you.
Thank you, everybody. The future of medicine. When I think about, I can't add any more than my colleagues have added. That this thought dropped into my mind. I think Maya Angelou said, the light is so bright it burns my eyes. And when I think about the future of medicine in conjunction with cellular therapy, whether it be peptides, whether it be placental tissue, whether it be stem cells, whether it be exosomes, whether it be nutrition, whether it be light therapy, the light is so bright it burns my eyes. I think we are part of the nexus of an amazing future in medicine. I think it's going to change, and it's going to change so fast. We're barely going to be able to keep up with it. But I think that, collectively, we support one another. We collect our data. We show it to those that, are empowered with our safety to some degree, like the FDA. That's that's what they do. And I believe that they're seeking, information from us. They want our data. They want our, they want our collaboration. They want more and more and more. They're hungry, just like we're hungry to change the world. So yeah, I'm just, that's how I see the future of medicine. Thanks, Marty.
Thank you. I want to thank our roundtable panelists, each and every one, an incredible doctor and a wonderful human being. This is what our organization is made of. This is Dr. Dayton from AASCP. Good night.